It's pointing.
Continue. Okay?
It's not block. Is it blocking you?
Oh no,
So we're going to finish up and try and get into the salivary glands and the tongue and things like that. Now I'm asking the lecture tomorrow, I thought it was on Friday, but it's tomorrow on the inguinal canal. So asking you, prepare. If you don't prepare for that lecture, dead story. You might as well not come. You just stay and relax. You have the inguinal canal is one of the top shells, the most important of the topics that you will learn in anatomy, like the breast and the stomach and the liver. So there are certain things that you have to know about. And the inguinal canal. So this is our student. Got like A+++ in the year above him. A+++++. Brilliant young lady, she's that right there. Exactly right there. Okay? Oh, I think in her neuroanatomy, she got up in the 90s. She loves the brain and all of that. Anyway, so yesterday, good friends communicates with me. And what we're doing in the surgery rotation, we have to like a junior surgery class or so. I was the first topic we're dealing with, the inguinal canal. And it must know about. And she, I think, enjoyed it. Okay? Because she grasped it in very well. And she took it up there. And then over with the patient, with the inguinal hernia, she can know exactly what is happening. Okay? She's not lost at sea. You're not going to be lost at sea. And there's no land inside. So you don't want to be lost at sea. Okay? So you want to have your handle on the thing. Okay, that's why you pass through there to learn and that's it. Okay. So let's just start. The very interesting the skull that we're looking at here. Determine a person from 1800s. Right. So I was very lucky to get this skull. Right? Very fortunate. So there was a very famous doctor, surgeon, and he went in the 1920s, well, 1923, to King's College in London to study medicine. 1923, more than 100 years ago. And he became SMO for KPH Hospital and all of that sort of stuff. Dr. McFarlane, Aubrey McFarlane. So when he passed on, his friend had the skull, the skeleton, so I got the skeleton that he studied. So this is the skull. And you see by the way that the person had a fracture. You can zoom down on it. Fracture. So, yeah, let it fill up the whole thing, right? See that the person had a fracture to the mandible. Okay? Now just to say about that, Dr. Bleding was asking about this retromolar space. Right back here. See the retromolar space? So I knew a guy and he weighed about 250 pounds. More. Big. Maybe more. Maybe 80. Big guy. He got in an accident. Fractured his mandible. And for 6 months they had to wire it up. So he couldn't have any nice big plate of food or anything. So he was dependent now on what? Soup. Soup. Right. And very interesting to see him after the 6 months. He was as slim as ever. Slim. Just like his man. So, if you want to lose weight, more than a story, if you want to lose weight, soon. And you didn't wear off his mind. So all you had was like a straw. Right? And then that's the thing. But if you never know anybody who wants to lose weight, you can tell it. And in 6 months, sight of this young lady. Very good. Alright, we're just having fun. And we see in the exam there will be a number of foramina that are asked as well. They will all relate to what gut. Okay? How is this related? How is this foramen related to gut? This is it. Infraorbital foramen. What does this have to do with gut?
Sir, the infraorbital nerve passes through it.
300 marks. Wow, very good. So the maxillary division of the trigeminal will divide terminally. Remember, it passes through the what? Foramen rotundum. Can you get that, my friend? Camera person? Yeah, see right there? That's the foramen rotundum. So the maxillary division of the trigeminal passes through the foramen rotundum and enters a space called the pterygopalatine fossa. Do you know anything about the pterygopalatine fossa? Yes or no?
No.
So this also comes in the exam and is one of the most popular questions. Right? In every gut exam, the skull is there, and this is asked. What is it? Oh, very good. Pterygopalatine vision. Reversing Fill it up. Fill up this with the gap. Please. Very good. What does that say?
Pterygomaxillary fissure.
Pterygomaxillary fissure. Okay. Why is it called pterygomaxillary fissure? Right? Because it's between the maxilla and the lateral pterygoid fissure. What do you know about the lateral pterygoid fissure? What do you know? 300 pounds. So, the lower head, inferior head of the lateral pterygoid is going to come from there. Yes or no? Yes? Fill up the screen, you come down and it's hard. Excellent. Take a picture of it. Right, take a picture of it. And take a picture of the pterygomaxillary fissure. Red. See the pterygomaxillary fissure? And this is the lateral surface of the lateral pterygoid blade. And then inside we see what? The medial surface of the medial pterygoid. And that is called the medial pterygoid muscle. So immediately we see this person had very developed lateral and medial pterygoids. See that? Massive. Look at it on the other side. Massive. Okay? Right, so that's for the medial pterygoid, and that's for the lateral pterygoid. So, as I said, that's the foramen rotundum, and passing through there is the maxillary nerve, goes into the pterygopalatine fossa. And how we got to that point is that when you go through the pterygomaxillary fissure, you enter into the pterygopalatine fossa. The maxillary nerve is then going to divide into two branches. And those two branches will be what and what? What are the two branches? And that's the infraorbital dimension and the zygomatic. However, the maxillary nerve, while it is within the pterygopalatine fossa, is going to send branches that come through the pterygomaxillary fissure and penetrate the bone here. Right, so what is really on the ball now? And that's the posterior superior alveolar nerves. Okay? We didn't ask in the exam what passes through the fissure. Now we ask the fissure bone nerve. The maxillary arch enters it, and the posterior superior alveolar nerves, vessels, exit it. Okay? So sometimes you can actually look down and you can see all the little small foramina there. And I can see when everything there is all perforated. Okay? Right? So the infraorbital nerve will come here, and the nerve is going to trifurcate bifurcate into a branch for the lower eyelid, half over branch, a branch for the lateral aspect of the nasal cavity, nasal branch, and the labial. So the upper lip, the upper lip is going to be supplied by the labial branch of the infraocular. Labial branch of the infraocular. The lower lip is going to be coming primarily more from the mental nerve, maybe some filaments from the buccal nerve, buccal branches of the mandible, primarily from the mental nerve, which is coming right in that region. Right? Alright, so we turn it over here, and then we see something that is super important right there. Who is this foramen right here? That's the incisive foramen or canal for which nerve? Oesophagus. Okay, okay. What is this that we're rubbing on here? Horizontal plate of the palatine bone. And this bone is what? Palatine process of the maxilla. You can see it makes like a cross. Fusiform suture. See there like that. Okay, there. So this is for the greater palatine nerve and vessels, and this is for the lesser palatine nerve and vessels. Very good. Very good, very good. Okay. So zooming hard in here. Right. So there we are in the land of TM.
What did you say this is?
This is for the greater palatine, this is the lesser palatine.
Unlock and protract. Unlock and protract. Nerve supply to the joint. Let me ask somebody. This young lady, what's your name today? Crystal? Can you remember? Crystal. I don't know.
I don't know what it is.
Crystal. And what is her name, Angela? Melissa. Crystal. Melissa. And your name? Davia. Davia. Oh, yeah. And gentleman here. Oh, this is very funny. What I'm going to ask you when you come to work later, right, Patrick? You have to help us to set up the computer, isn't that so? Right, so when I went to the last lecture, I was asking somebody just to come and set up the thing.
Check for the IT report.
But you can all do it, right? You can all do it. We have to walk in life. We have to walk to help. Is that so? But you have to sit asking for help when you just like a black. So you have to help. Okay, so just as we are all helping you. Okay, so what is the nerve supply to that joint?
Auricular temporal.
Remember I told you the last time?
I think so.
What did I say about auricular temporal nerve in the exam?
It comes on the
Many answers are
Auricular temporal.
nerve.
What did he ask?
So the auricular temporal nerve in the upper
Auricular temporal
compartment of the TMG, what kind of movement is occurring? Dominic, what kind of movement occurs?
Arnold.
What kind of movement? Sliding. Anybody remembers another name we use for sliding? What kind of movement? What is another name? Exactly. Translation. Gangliomo-arterial joint. Right? And then in the lower part you're going to get the ganglimus, the hinge joint. Right? It's on the skull. Okay, mental foramen, we know all about. Apparently, I don't need to ask you about the mental foramen. Not at all. You know all of that. We're going to try to find something that Lodenquai could ask us to look at.
Sorry, while you're there, the computer experts, I noticed that on artificial intelligence there is a so-called note taker. I noticed everybody busy writing notes. And there's a note taker. Robert? It's Robert, isn't it?
Yeah, he's a Robert.
Robert.
This is Robert behind us.
Have you heard about note taker?
Robert, greetings.
Huh? Have you tried it?
Yeah, it's not good.
Right.
It doesn't take everything word for word.
I mean, I don't expect you to say everything word for word, but important. You know, the problem why I didn't try it out is that there's a cost, no?
Yeah, I pay for it.
Yeah, you have to pay for the note taker. But I say everybody busy writing notes while Mr. Gardner is speaking.
Excellent.
So the note taker might be for those who can afford it. Or like last time, you all put together in one person. Robert was the man who take the pictures. Yeah, they have the second took the pictures. Yeah, he made the note. But the note taker will make the notes.
Okay, so there now we see the picture tympanic visual. And that picture tympanic visual is where the quarter tympanic nerve is going to exit, right? The quarter tympanic, there. So take a picture of that, that's the quarter tympanic. So the facial nerve is going to give rise to that quarter tympanic. And we said that quarter tympanic is carrying impulses out and impulses in. The impulses in are what? Gustatory. And the impulses going out are
Sensory.
secretomotor. Okay? Right, so there you can see now that's the picture tympanic visual. And then that's the opening of the carotid canal. And behind the opening of the carotid canal will be the jugular canal, jugular foramen. And in between the two, if we zoom down, in between the two, right there.
Try and get sure.
Yeah, see there now? In between the two, that opening that you see right there, in between the jugular foramen and the carotid canal, that is the tympanic canaliculus. And that tympanic canaliculus is going to transmit the tympanic branch of the glossopharyngeal nerve. Okay? Alright. Okay, let's relax. When you see the probe going like this, that's the anterior condylar canal. And that's for, focus it a bit. Yes, very good. And that's for the hypoglossal nerve, right? So the hypoglossal nerve is going to come through this anterior condylar canal. Okay, that's for the hypoglossal nerve. We're just continuing. Okay? And we see, of course, the stylomastoid foramen for the facial nerve. Facial nerve is going to emerge right here. So when I come inside, let's just focus on this point. Right here. Zoom in on him even more. Yeah, or is that maximum? Maybe that's another maximum. Okay? So what are we looking at here? It's the internal acoustic meatus. And who is going to go in there? 7 and 8. And 7 is carrying his son with him, and his son is what? Nervus intermedius. Okay? And nervus intermedius is very important for salivary function. Right? For salivary function. So it's going to secrete a motor to the submandibular gland, the sublingual gland, and the glands of the anterior 2/3 of the tongue. Gustatory. Right? Gustatory. To the taste buds of the anterior 2/3 of the tongue, but with exception to what? circumvallate the brain. So we have to know about these foramina in the skull. Let's focus back on this here. Come up here. Right. Zoom in a bit more. Yeah, just to make this area, fill up this area here. Right. Just relax. We see exiting the foramina valley, the mandibular division of the trigeminum. It has an anterior branch and a posterior branch. What are we viewing here? Are we viewing either the anterior or the posterior branch? Dominic, are you looking at the mandibular division of the trigeminum? When you look at this diagram, are you seeing mainly the posterior division or the anterior division? Posterior, why? P.S. the posterior is more sensory. Isn't that so? The anterior is motor. The posterior is sensory. Okay, and the major sensory branch is coming off for what? The lingual nerve. Right, okay, the lingual nerve, very good, my dear. Inferior alveolar. We see where the inferior alveolar is giving off what? The nerve to malahyoid. Okay? Relaxing. So, the inferior alveolar, the lingual nerve, and the auricular temporal nerve. Okay? These are boys coming off the posterior division. And we will see also that from the trunk, who is coming out from the trunk? The nerve to malahyoid and the nerve of spinosus. Right? Isn't that so? That's going back to supply the neuron of the middle cranial fossa. Okay? Relax. So the
Very
posterior
relaxed
branch
right now.
is going to give rise, relax, is sensory, and is going to give rise to our lingual nerve and our inferior alveolar nerve and the auricular temporal. Right? The lingual nerve is joined by, I showed you on the specimen, the chorda tympani. And a lot of answers in the exam are chorda tympani via the lingual nerve. So that chorda tympani is going to carry gustatory function. Right? So we said what's the name of this video? So Melissa, very good. So Melissa's boyfriend is going to save up his money. And take you out for a nice dinner.
Okay.
Reasonable?
Yeah.
Right. And you're going to enjoy it. And all of that information is primarily carried by the chorda tympani via the lingual nerve. Okay? And then where does this taste in the exam, in the gustatory, in the gut exam? Where does taste end up on the brain stem? Where does taste end up on the brain stem? Nucleus of the tractus solitarius. What is that? Nucleus of the what? Tractus solitarius. Nucleus of the tractus solitarius. Okay, relax yourself. So, the gustatory signals end up in the nucleus of the tractus solitarius. And living beside the tractus solitarius is the superior salivatory nucleus. So as you're tasting and things are great, you're now stimulating. So one of the major afferents coming into the nucleus of the tractus of the superior salivatory nucleus is what? From the nucleus of the tractus solitarius. Two important things you must know. Nucleus of the tractus solitarius and nucleus ambiguous. Oh. So put them in a box and put stars all around. Nucleus of tractus solitarius is nucleus ambiguous, motor to cranial nerves 9, 10, and 11. So the pharynx, right, supplied nearly all by from the nucleus of the tractus solitarius. But most of the time it's stylopharyngeal. What supplies this problem? What supplies the stylopharyngeal?
Glossopharyngeal.
The glossopharyngeal. Right? But nucleus ambiguous is going to give motor to all your swallowing and all of that. Very important. And then we need to know the superior salivatory nucleus, which is for secretomotor activity. And living a little further down the stream is the inferior salivatory nucleus. And he now is going to be for cranial nerve 9. So this boy is destined for the parotid. Right? This guy is destined for the parotid. So glossopharyngeal covers the parotid, covers the oropharynx, right? And also very important, this will be sometimes called stylopharyngeal. It actually, just like when you see a grapevine running around something, the stylopharyngeus, the glossopharyngeus kind of winds around the stylopharyngeus muscle. Okay? Okay, relax. So we should know all these things. Okay? No, let me get back. Alright. So corner tympanic passing through the pituitary fissure. No. The gustatory pathway. Let's have this a little fun. The gustatory pathway has how many neurons? How many neurons are in the gustatory pathway? 3. And where are these neurons? What do we know about these neurons? What do we know about these neurons? What do we know about it? What do we know about this? Yeah. So nearly all sensory pathways are controlled by 3 neurons. A first order, a second order, and a third order neuron. Okay? Now this is the teeth. Gustatory pathway. Okay? And notice all of them look like octopus. You think. The outward one is called a peripheral process. And if we're going this way, then these processes that are going this way are what? Central. These ones over here are more peripheral. Okay? So this is the first order neuron. Just having fun, relax. This is the second order neuron. And this is the third order neuron. The second order neuron we know already. That is what? Nucleus of the tractus solitarius. Reasonable? No. Where do you find the cell body for the first order neuron? In teeth. She knows it. She knows it. So you're coming from the receptors on the tongue. Is that so? Yeah. What's your name again? Okay. So name again is David, right? David. Very good. So David. You say so. Yeah? Carries over. And you're excited. Right? For a night. Okay? So that is going to go via lingual and the chord tympani nerve. And where is the cell body for the first one? In the genicular ganglion. In the genicular ganglion. This is genicular ganglion. So, Robert, where is this genicular ganglion? Robert, where is this genicular ganglion? Okay, pseudo hard.
I know it has some term.
Hard. Right right here. Right here. So, the genicular ganglion resides in the intertemporal bone. The facial nerve, nervous intermediates pass laterally and then posteriorly. And when they're making this curve, there's a bump. So within this bone, I could remove all that part of the bone called the tegment tympani, and down in there is the what? You build the what? The genicular ganglion. Okay, so the chorda tympani nerve will pass up through the intratympanic fissure, and his cell body is in the genicular ganglion. He's going to send in a central process. This is a peripheral process, this is a central process. And that central process is in the facial nerve, reasonable, and then ends up in the nervous intermediates. So that's very important, is the nervous intermediates. And the nervous intermediates now ends on what? The nucleus of the tractus solitarius. Then you don't have to notice this term. When you do neuronal, it's going to go into the thalamus. And which nucleus of the thalamus, Robert?
Ventral posterior median.
Correct, VPN. Right. And then, Robert, where will the sensation finally end up?
On the post-central gyrus.
Yes, very good. In the lower part of the post-central gyrus. What's that part? What's Brodmann area 43?
That's the
Brodmann
subcentral gyrus.
subcentral gyrus. Correct. You have to be sharp in a rubber. When you're sharp,
Can never satisfy
hold on. When you're sharp, all the girls will want. Alright? So VPS, reasonable, and then you're going to end up on Brodmann area 43. Reasonable? So you have the first order neuron, the second order neuron, and the what? The third order
This is
neuron.
new one. This is like talking about
Here, man.
taste
This way.
and the different
Alright, so here we're seeing now, give a chance, there we're seeing the chorda tympani, relax. The chorda tympani, and you're joining the what? The lingual nerve. And then what is subtended or suspended on the lingual nerve? Zoom it up. The submandibular ganglion. Okay? That's the submandibular ganglion. So the postganglionic cell bodies, the secretomotor fibers for the sublingual, submandibular glands, they lie there. Note that the inferior alveolar nerve gives off a motor branch. So that motor branch is known as the nerve to mylohyoid. Nerve to mylohyoid will supply the anterior of the digastric and the mylohyoid. Now, medial to the trunk of the medial to that mandibular division of the trigeminal nerve lies this boy. And who is that boy? Otic ganglion. Robert, what's the relevance of the otic ganglion? What occurs in the otic ganglion?
That's where the Jacobs, that's where the lesser petrosal nerve goes.
Okay, so the lesser petrosal nerve ends there. But what is that? So we're making a box, you know, otic ganglion. It's in the exam. Yes. So what is the significance of the otic ganglion? So that's where we're going to find out. So this ganglion in cell bodies for the parotid. Right? So the parotid gland. Just so the parotid gland story begins where? Let's have it for. Begins where does the parotid gland story begin? Robert, where does the parotid gland story begin?
Repeat this.
Where does the story of the parotid gland begin in terms of its nerve supply?
Inferior salivatory.
Inferior salivatory nucleus. Right? Then leaves by which nerve?
Plus the pharyngeal.
Plus the pharyngeal. Leading through which foramen? Jugular foramen. Isn't that so? Jugular foramen. And then that nerve is going to give rise to what? A tympanic branch. And the tympanic branch, we said, goes up through the what? Tympanic cavity. Leads us up into where? Middle ear cavity. Right? Leads us up into the what? Middle ear cavity. What happens in forms the tympanic plexus. So within the middle ear cavity is something called a what? Tympanic plexus. From that tympanic plexus, who comes up? Oesophagus nerve. The Oesophagus nerve descends through which foramen? Foramen ovale. M-A-L-E. The E. Right? Sorry, the L. Oh my God. Breathe freely. So, there is the Oesophagus nerve, that's all. There is the Oesophagus nerve, and he ends in where? The otic ganglion. Right. Then post-ganglionic cell body, so jump off of it. Right? Go into the posterior division of the mandibular division of the trigeminal nerve and form a nerve called the what? The auricular temporal. Auricular temporal nerve. Very important nerve. And that auricular temporal nerve, wow, has many functions. Lord, give me some functions of the auricular temporal nerve.
PMJ.
Okay, so PMJ.
Innervation of the parotid gland.
Skin above the tragus.
Wow.
Parotid gland.
Skin above the tragus.
And then secrete amount of
Sensory
fibrous
skin. Sensory to the what? Skin above the what? Tragus.
And it doesn't also innervate the submandibular.
Secretor. Motor.
Parotid.
Parotid. So that auricular temporal nerve is always at the exam. Reasonable?
Can you see what the submandibular one is? This auricular temporal line. Which one is auricular and great auricular? Or just great
Relax. The auricular temporal nerve, when you get on into the next term or the last term, clasps the middle meningeal artery. And they will see the facial nerve coming down. No, parotid gland. Let's look at some specimens now. Okay? Right.
before you show them the height.
What is it, class?
Okay, you're perfect. The middle meningeal artery.
Mm-hmm.
So where's my red point? Where is it value? Where is my red point? Just go. Anytime. Whoa. You can see it's been asked in the exam a lot. Now this score, it was studied a lot. You know, Patrick? You studied it a lot. Okay, here. There. What do we notice about the direction of the pointer? I told you last time. All of them tend to be going this way, this way, this way. How is this pointer placed? Oh man, give me the word. You're young people, I told you last time. When you see the probe placed how? She remembered diagonally. Very good. When you see the probe placed diagonally, it's going into the musculo-tubular canal. In the upper compartment of the canal is the tensor tympani, and the lower part of the canal is the musculo-tubular canal. That is what is the eustachian tube. The eustachian tube. Alright? The eustachian tube. Now, Dr. Lodenquai and Oesophagus, they were talking about nerve to the medial pterygoid. It's always in the MCQ exam. Always in there. What do we know about that? Nerve is going to supply, comes from the trunk of the mandibular nerve, will supply how many muscles? Two or three?
Two three.
Open three.
Tensor veli palatini,
Medial pterygoid
tensor tympani, and medial pterygoid.
tensor villi palatini, and tensor tympani. Patrick, anything else to show them?
Inside is what? The facial.
No man, I think next week 4 o'clock and we still have it.
Huh?
We have to leave this one.
Okay.
What? Dessert. Eat this one. Okay. Let me just show you a simplest definition. That one, before I show you how.
Never a lot of stations.
Yes, sir.
Mm.
All right. Oh, looks better today. Looks better today. Can we zoom in here? Wow, very good, my friend. Magic. Take a picture of this. This is gold.
You will.
This is gold here.
Remember you're on camera.
Because I've seen when you look into infratemporal fossils, it's almost 75 are going
We did this last week.
horizontal, backward,
So that was one of
and
the
this one is going
media lateral pterygoid.
obliquely. This is the upper head of the lateral pterygoid. Beautiful. And this is the lower head. Right. The upper head is coming from where?
The lateral pterygoid.
The infratemporal part of the greater wing of the sphenoid. And the lower part is coming from lateral surface of the lateral pterygoid. Please relax. It couldn't be better. Take a picture of this now, keep it as a screensaver. I want to tell you that. So take down the boys, the young man's picture and put this up. There. It's a much nicer screensaver picture. Right?
Screens?
There you can see it. That's all.
Very true.
Right, so there you see the upper head and there's the lower head. Then that's the medial pterygoid. Look how good that is. Fantastic. Right? Then we're seeing, what are we seeing right here? This is the, what are my friends here? Crystal. Crystal, what are we looking at here though? Just come out a bit off of it so you can get some kind of bearing. Yeah, reverse. More. Yeah,
Is that the masseter? Is that on the outside or the wing?
More. I want to get good. Excellent. Come on, Crystal. So crystal alone. Crystal, what is that? Is that a fair question? Feel like that was fair? Actually, fair or not?
Genial.
What is this?
Is your battle language?
Wait, why is he going viral? Get out of here.
I know it's not that yet. Or my life. I don't think it's my life. My life is like an overlap.
Is that your...
Type of.
So that's the anterior belly of the digastric.
Yeah, we did just say I thought it wasn't the
That's the anterior
digastric.
belly of the digastric.
Digastric was really
And what muscle is missing? That is then comes the anterior belly of the digastric. And who lies deep to the anterior belly of the digastric?
Myla hyoid.
Then who lies deep to the myla
Alright.
He's supplying that. Yeah, he's supplying that.
Digastric. Myla has 5 anterior belly of
You
digastric.
turn him over like this.
Myla has anterior belly of digastric.
Turn. Excellent. So who is this big block of muscle? Genial process. You can, by the way, sorry, zoom in fully here for me. More. Excellent. Who is this for? Who is this for? Right, so this muscle here is the what? Genial hyoid. take a picture of that. That's a junior hyoid. So therefore, this over here was within anterior middle of the digastrate. Okay. So I don't know what we set it off. You can clearly see the junior hyoid and the object. Junior glossus. Just relax. So we see the anterior middle of the digastrate. And then who's this big fellow right here? This is submandibular.
I thought it was Pharynx.
See right there?
Okay.
This is submandibular gland. Come on for it a bit. Right. So you can see the big submandibular gland. And who is this boy, Robert? Who is that? Who is that, Robert?
I don't know.
That's a submandibular gland.
No,
Yes.
Oh.
That's a submandibular lymph node. You can see the submandibular gland. Robert, who's this boy? Who's this boy? Yeah. The retromandibular veins. Right? This is the gland.
Yeah, that's
Okay. Continue. Excellent. Okay. Oh, very good. Very good. Come up a bit. Yeah, come up a bit. Not so much, yeah? Right. Okay. Right, relax. So there we can see the submandibular gland, okay? See the submandibular gland? We have things to do here. This is submandibular gland. And this big boy back here is what?
Pharynx.
Right? And the parotid gland, in that parotid gland, we'll see the what? The retromandibular vein. And we'll see the what? The facial
nerve and external
Zoom in
carotid
there.
artery.
I know there's a young lady back here, and I know there's a guy. It's a bird. How many times are there? I didn't look around and see it. There's a young man who said. So there was there's a facial nerve winding around what there? Retromandibular vein. Okay? And we can see the parotid gland right here, lying in the retromandibular fossa. And in front of him, who is this muscle? Who is that big muscle? Masseter. Okay, there we can see the facial nerve, and you see it's all dividing up. Look how complex it is. See it's all dividing up there. And then, when we look at this submandible, that submandibular gland has like a groove down into it. You see that there, Robert?
Yeah.
Look at that submandibular gland. He has like a groove. Right? So the submandibular, the part of the mandible has been resected. And the submandibular gland lies right in there. See where he lies? And a part of him is outside, so I can take my finger and put my finger in that groove. Right? And we can see part of him lies in the floor of the mouth, the oral cavity, and a part of the submandibular gland is extending superficially onto the surface. Okay? Which is what we saw on the last specimen. Very good. and we see the part of the submandibular gland. So a part of the gland, the submandibular gland, was part of what we have to accomplish is the salivary gland. Right, Patrick? Patrick, you there?
Yeah.
So we have to accomplish this boy. So it's a part of the submandibular gland lies superficially in the digastric triangle. You know which triangle?
Digastric triangle.
And then now he winds around, and when he's winding around, he's grooved. See how he's grooved? When he winds around, he's grooved, and part of it is now lying here. See right here? There. Boom. Right. See where he is? He's lying here. And this is in the submandibular fossa. And then, who is that boy right here? Mylohyoid line. Right, it's a mylohyoid line. So the submandibular gland. And when we look at the deep part of the gland, when we come back here, if we look down here, look right here. Wow, look at that. So the deep part of the gland is in between the mylohyoid muscle and this muscle that's coming down here. Anybody else? What muscle you think this is coming down here like a curtain? What muscle do you think that is?
That long no, the sternal triangle. Oh no, that's this is sternal triangle. I think that's parotid. That's in parotid.
So this is the same thing you're looking at right here.
I don't think it's that.
This is the exact thing. Alright? So the muscle that is underlying there is a muscle known as the hyoglossus. Right? And who do you think this muscle is that they've cut open right here? No, that's the mylohyoid. So the deep part of the gland lies right here. Hold this right here, hold this one. Hold this forceps. Yeah. So if we flap this down like that, so if we flap the mylohyoid down like that, the deep part of the gland is where the forceps is, between the hyoglossus and the mylohyoid. Right? You follow me? And then it winds around and comes out. That's all.
Yeah.
And we'll see that is in relation to the hypoglossal nerve and the ringworm nerve. Okay? So, let me just give you an idea what is happening. Where's my thing? Here. What is that? Okay. So watch now. Just look at this. This is the mandible like that. Watch the diagram. Then that's the mylohyoid line. That's the mandible coming on. And this is a tooth. Rather big tooth. Yeah? Then this muscle comes down here, it's called a rubber mylohyoid. You follow me, yes or no? See the mylohyoid coming down like that? And this muscle on this side here now is the hyoglossus. The hyoglossus is going to go right up on the wall, the tongue. That's the tongue right here. Reasonable? So the deep part of the gland is occurring here. That's the deep part of the gland right here. The superficial part comes like this. So the superficial is like this. Okay, see the superficial part? Do you follow me, yes or no? So the mylohyoid muscle lies along here, yes? And the superficial part of the gland, I should say, the superficial part of the gland is partly on the cover of the mandible and then extends on to the side of the neck right here, in the digastric triangle of the neck. Okay? The gland is going to wind around the mylohyoid. Okay? And then now the deep part of the gland is between the mylohyoid and the hyoglossus. Okay? So the deep part of the gland is between the mylohyoid and the hyoglossus. And what is happening? We're looking down on the specimen, say we're looking down on it. Okay? That's how the gland is. Say we're taking a view looking down. The gland is like this. This is how the gland is shaped. Like a U-shaped magnet. This is looking at a horizontal section through the head. So watch me, look right here, watch. If you look at a horizontal section through the head, then this muscle is what muscle is this? The mylohyoid. Right? So the superficial part of the gland is out here. The deep part of the gland now is between the mylohyoid and which part? The hyoglossus. Right. Okay? And this part of the gland now has relations to, so what covers this part of the gland here? So the superficial part of the gland here is related to Robert. What muscle is this? What muscle is that? What muscle is this? Platysma. Right. That's covered by the platysma. And about a finger's breadth below, which nerve is going to be lying right here? Which nerve is about a finger's breadth below? That's the cervical branch of the facial nerve. Right? So that, not the cervical branch, that's the mandibular branch of the facial nerve. So the mandibular branch of the facial nerve. So the ENT, the plastic surgeon and all the ENT surgeons and all of these kind of things, they have to know that this marginal or mandibular division of the trigeminal nerve lies right here. Okay? So when you're going to do surgery on the submandibular gland, you have to be very careful of this nerve. So outside of that is skin, platysma, and then we find a finger's breadth below the mandible, the cervical, the mandibular branch of the facial nerve, sometimes forms a neural hammer, and then there we see the superficial part of the gland. And then now it winds around the mylohyoid and becomes a deep part of the gland. Right? So when we look at the deep part of the gland, just relax. When we look at the deep part of the gland, there is the tongue, and on the side of the tongue is a muscle called the hyoglossus. That's the hyoglossus right here. And lying on that is the submandibular duct. And what structure winds around the submandibular duct? Thank you for not following me. Yeah, what structure winds around the submandibular duct? Like that. And that's the lingual nerve. The lingual nerve double crosses the submandibular duct on its lateral and then inferiorly. And then on the hyoglossus right here, this is the 12th cranial nerve, CN12. Okay? And CN12, just for fun, is surrounded by a lot of veins. We'll do them. There's a lot of veins there. Robert, you know what I mean when these veins that surround the hypoglossal nerve?
I do not.
Okay? The venae comitans nervi hypoglossal. What? The venae comitans nervi hypoglossal. Okay? And then now, if you want more anatomy, you see that the lingual artery is here, and the lingual artery makes a characteristic move up like that, down, and then travels deep to the hyoglossus muscle. So, then watch here. Over all of this now is the deep part of the gland. So the deep part of the gland overlies all of this. It's like a loss. Yeah. One year before. Right? So the deep part of the gland overlies. So the deep part of the gland is in relation to the hyoglossus. Relax. And then these nerves, cranial nerves, lingual nerve, the hypoglossal nerve, and the submandibular nerve. Right? And then overlying all of this nerve is going to be the mylohyoid muscle. Right? It's like you're all lost. But you have to what? You have to do some what? Breathing. Okay. Now let's take a breather. Alright? But you have to read this thing, okay? But remember, the important thing is that the superficial part of the gland, watch here, the superficial part of the gland winds around which muscle? The mylohyoid, like a U-shaped magnet. So part of the gland is superficial, right here, and then it winds around and then goes into the floor of the oral cavity. Okay? So if you push it over down there, and the submandibular duct is right beside the frenulum. So you see that submandibular duct? You see the submandibular duct right here? It's going to open onto this a little punctum, right, Patrick? Right into the papillum. So under your tongue is something called the what? Frenulum. And you lift up your tongue when you go home and look in the mirror. And you see two papillae. And sometimes, if you're studying in the night, you accidentally drinking coffee or doing something, you open your mouth, sometimes you see a little a bit of spray. Like a snake. Have you ever seen that? You study and you open your mouth and then you get sprayed with something like that. None of you?
Yeah, that happens now.
Tell me I'm not the unusual man. So,
Yeah.
under the tongue is where the submandibular duct opens. Sometimes if you open your mouth and you're reading in the night or so, you see it there? Alright, good. And you see that the shovel just come out. Right? That's how you know. Hold it. Alright? So there you can see that's where the deep part of the gland is. So the deep part of the gland is in the floor. So if you cut the mucosa, you see the deep part of the gland. And it winds around and becomes a superficial. Now the parotid gland, see, look, let's look down at it now. See, let's look at the parotid gland. Parotid gland is the largest of the salivary glands. Zoom it beautiful. See him right there? So he's dissected open, right there. Okay? Very good. So you see the parotid gland and a dissection has been done into it. Right there. Look at that. And there's a retromandibular vein. And you can see the facial nerve winding around it. Okay. Now, let's do a diagram. This one for them is not a hard diagram. Okay? It's not like the submandibular. It's much easier. Okay. So, we have two bones. So when we put the mandible back on, watch here. With the here. When we put the mandible back on like that, look at that. There. Okay, there. Right there. You can zoom in here for me, please. Right. Excellent. So the parotid gland lies in a space known as what? Retromandibular fossa. The retromandibular fossa has a bone in front, and what's this bone called? The ramus of the mandible, and it has a bone behind it called the what? Muscle fossa. Okay? So we can do, I'm going to draw now a horizontal section through the parotid. Okay? So, you're going to have patients that are come to you and they're going to have parotid tumors. Okay? Well, in an infection called mumps, the parotid glands enlarges. Okay? But because the parotid gland has such a thick fascia over it, it can't expand laterally. So it expands medially. So it expands into the oropharynx. Okay, it will expand, going and narrowing the area of the oropharynx. Okay, so parotid tumors, and I'm going to tell you a case of a parotid tumor that we worked on. And most important is that let's take up. So this is a horizontal section. So what if you can come down on the diagram? Here's a man like that. That's his nose. That's his head like that. And these are his ears. Right? Yes, his nose there. He has a nose like that. Good. And his parotid gland is going to lie right here. See where the parotid gland is? And it looks like a slice of cake.
That's it.
Like
I
that.
wouldn't like that.
Right. So we're going to take a view looking down on it. We're going on a 10-minute journey. On a 10-minute journey on the parallel. So there, watch. So in front is a what? A bone. What's a bone? The ramus of the man. Behind is what? The mastoid. So the parotid has a bone in front and a bone behind. The bone in front is the ramus of the mammal. The bone behind is the mastoid process. It has two muscles in front and two muscles behind. Okay? So what are the two muscles in front? Right? So this is, by the way, this is lateral and this is medial. So therefore, the muscle in front is going to be the what? Masseter. So this muscle here is the what? Masseter. This muscle back here will be the what? What muscle is it? Oh, this young lady beside me, very good. The sternocleidomastoid. Wow. The muscle over here now will be what? What is this muscle now? It's a masseter. This is a medial pterygoid. And then what muscle will this be, Robert? Wow, very good. That's it. Posterior pterygoid. Digastric. Excellent. So the gland is going to look like this. The gland will overlie the masseter, right? Overlie the masseter. Overlie the what? The sternocleidomastoid. Come like that. Come like this. Very good. Come like that. And then in like that. Right. So that's all the gland is going to look. See like this, like that? It's like a wedge shape. Okay? Then we said he's coming into the what? To the pharynx. So right here, this is the pharynx right here. Wow. This is the pharynx right here. That's the oropharynx. Right, hold on. Excellent. And a nerve is right at the apex of the gland. Robert, what's the name of the nerve at the apex of the gland?
Auricular temporal.
Excellent. The auricular temporal. So this boy is called the auricular temporal nerve. 300 miles. Okay? Then, who are we going to get here now? This is going to be the styloid process. What's the styloid process? Yes or no?
Yes.
How many muscles are attached? 3. 1, 2, 3. What are the 3 muscles? So this is the styloid process. This muscle is what? How to put that one? Wow, stylopharyngeus. This boy is? Stylohyoid. This boy is? Styloglossus. What's your name again? Livio. Stylohyoid is supplied by which nerve? Facial. Styloglossus is supplied by who? Hypoglossal.
Which one?
Stylopharyngeus is supplied by
Glossopharynx.
Who lies posterior lateral to the styloid process? Who lies posterior lateral to the styloid process? posterolateral to the style process. Look like posterolateral. Zoom in a little hard here for me. Hard.
Someone say something, but I remember to the camera.
Excellent, my dear. So there's a styloid process, and posterolateral to the styloid process is the what? The stylomastoid foramen. You see the foramen there, yes or no?
Oui.
See right there? At the tip of the pointer. There, see right there? Right. Who emerges? Right. And this is a mastoid process. Who is this big groove here called? Mastoid incisor. Who is arising here? Posterior belly and digastric. Who is here? The sternocleidomastoid. Okay? When we come back to the diagram. So posterolateral to the, watch here now, posterolateral to the styloid process is the one? Stylomastoid foramen. Stylomastoid foramen. Very important. Who emerges from there? Facial nerve, right? And the facial nerve, when he emerges from there, what is he going to do? He's going to supply the posterior belly of the digastric. Right? Who else will he supply, Robert? Yes, the stylohyoid. Who else will he supply? Auricular muscles. And who else will he supply? Occipital belly of occipital tonsills. Okay, then the facial nerve is going to do what? What does the facial nerve do? Boom. He travels right through the parotid gland. Right? He's traveling right through the parotid gland, dividing the parotid gland into a superficial lobe and a deep lobe. Who lies directly deep to this? Who lies directly deep? There. Who lies there? There. That's the retromandibular vein. And this retromandibular vein is formed here by a maxillary vein and a superficial temporal vein. Right? And then now we're going to see the terminal branches of the what? The external parotid artery. Who are these boys? Maxillary artery and the superficial. Or we could just put the two together and call them external parotid artery. Okay? No. What else do we have to put in there? Robert, what else we need? What do you want to miss about? Oh, no, Robert, what are we missing? No, what are we missing?
Because we're inside the parotid.
No, man, no, relations.
Carotid sheath. No, carotid, internal jugular.
Carotid sheath. What are we missing? Carotid sheath.
That's the deep.
And who is in the anterior part of the carotid sheath? Who is in the anterior part of the carotid sheath? The ICA. The internal carotid artery. And who is in the posterior part of the carotid sheath? Internal jugular vein. In there? That's internal jugular vein. Cranial nerve 12 is here. See 12 right there? Reasonable? And glossopharyngeal nerve is right beside the glossopharyngeals. Just exactly beside it. And then we'll have cranial nerve 10 and we'll have cranial nerve 11. So in the carotid sheath there, 9, 10, 11, and 12. 9, 10, 11, and 12. ICA and internal jugular vein. Right? This is going to be covered over by what? Very, very thick structure known as the what? What covers the structure that's very thick? Parotidomasseteric fascia. Upward continuation of the deep cervical fascia. Overlying that is what? Overlying this is what? Skin. Right. Where are we going to put the parotid nerve? Where are we going to put the parotid nerve?
Parotid nodes.
Yeah, where was this
Between the
parotid?
parotid and the flammable gland itself.
Yes, correct. There. And then histologically, you'll actually see the parotid moving in. Reasonable? And then you have to put a nerve. So, Robert, which nerves are there now? Which nerves are there? Which nerves are
Passing
there?
through it or supplying here?
Oh man, how much nerve is sensory over here? Robert knows, you know. See the nerve
The
right
plexus
here? Yeah, great auricular nerve. So this is the great auricular nerve. Very good. So there we have the anatomy of the parotid gland.
Very simple, very simple.
Very simple. Very simple.
Resorius muscle.
She's being
Resorius.
Pardon?
Resorius muscle. Resorius muscle. Resorius.
Oh, resorius, yeah.
Subcutaneous.
Correct, subcutaneous. So some resorius fibers are going to come in. Right? So the parotid gland. Just relax. Let's just come off of it. Zoom off of it a little. So let's go over the points. Robert, what are the main points about the relation to the parotid? Robert, main points. Shape, what's the shape of the gland? Wedge. Has a lateral surface, yes, facing out. You see the lateral surface, the base is the lateral surface, it has the apex. And this space is referred to as, what is the name of this space here, Robert? What is this space here called?
Parapharyngeal space.
The parapharyngeal space. Now that space is a dangerous space, you know. Okay, a dangerous space. Right? So Dr. Ashman, who used to teach at the hospital, in ENT, but maybe it's over there, he would examine hard. And one of his areas that he was very hot on, very interested in, is tumors in the parapharyngeal space. Okay? So in people of, like Dr. Lodenquai, Chinese descent, Asians, they tend to present with tumors. No, we don't once in a while, okay? They will bring their tumors in this parapharyngeal space. Right over there, see right by that over? Maybe a couple of years ago, Dr. Ashman and myself are examining right over there with the surgery resident. Could be wrong, could be right there. Okay? In a surgery ward. And an ENT surgeon would be examining. So Robert, if you have a parapharyngeal tumor, it may extend out through where? Where one of the sites of parapharyngeal tumor and easily extend out? The foramen ovale. Right. And if it extends up through the foramen ovale, where will it extend into? Into the cavernous sinus.
Oh.
Right. And from the cavernous sinus, what is one of the major voids draining into the cavernous sinus? So into the orbit. Right? So that parapharyngeal tumor may extend right over there, twisting when they pass through the lower. Extending through the foramen ovale, up into the cavernous sinus. And by the way, when it goes into the cavernous sinus, who will pile of problems in the cavernous sinus? A whole set of things that are in the cavernous sinus. Like what is in the cavernous sinus? Which cranial nerves?
3, 4, 5, 1, 5,
3,
2, 6.
4, 5A, 5B. Yeah, right? Yeah, and what is it? And 6.
Yeah.
Right? And then now the tumor may go and go right through the superior ophthalmic vein and get into the organ. Okay? So parapharyngeal tumors are deadly. They're not too stories at all. And they extend in this space. Now sometimes that space can become abscesses may develop, all kinds of things may develop in that space. The retropharyngeal space, which Dr. Lodenquai will talk about, is another area of great interest to you. Okay? But the parapharyngeal space. So the professor of surgery, no, the professor of neurology was my good friend. when we had an interesting case, you said, Michael, come up and watch and see what I'm doing. And he had his neurology lab, right? Where he would on nerve testing and all kind of different things. And on a Friday evening, sometimes I'm like, come on. When we were lab with all kind of oscilloscopes and all kind of stuff, and things to go to muscles and nerves and all that. And you do nerve testing. You say, listen to the sound of the nerve. When the nerve is firing normally. Okay? Now it says about case now where there was an abscess in this area there, and the surgeons went in, the ENT surgeons. But boy, it was a disaster. Because at the end of the day now, the patient couldn't abduct. Right? The patient couldn't abduct. The patient was having the side of the tongue atrophy. The side of the patient that tongue atrophy. He couldn't abduct. All sorts of crazy things like that. The surgery. And you all related to what? The nerves that are there. So in that surgery now, the accessory nerve was damaged. Right? And especially the spinal root of the accessory. So you can't, trapezius was what? Paralyzed. Sternocleidomastoid was paralyzed. Oesopharyngeal nerve was affected. All different nerves were affected. Right? So that area, you see this area right here? It's a tight area. Very, very, very tight area. Okay. Let's move on. Let's move on. What is that? Excellent. We have a beautiful one. Tongue. Right? There you can see a nice tongue, and I will show you the real specimen. Okay? But we will just, for fun, start with this picture. Now, zoom in hard on it. Yes, good. You see some boys here. Who are these boys?
Circle.
Then we see a move. Who is that term? Sulcus terminal. Then we see a hole. Then we see now some little spiky things. Little spiky boys? What was it, spiky boys? Filiform. What's the function of those filiform papillae?
Sweet.
What's the function of those filiform papillae?
For rasping.
Rasping. What kind of activity?
What is it?
When you use rasping, when are you using rasping? Like you're licking an ice cream cone. You're licking a what? An ice cream cone. Is it ever? That activity is called what kind of activity? Rasping. So these are for the mechanical function of rasping. Is it ever? Then we see these boys here. You see they're studying all over. What's the shape? Mushroom. So these boys are the fungiform. Relax. Fungiform. So these boys have no taste buds. These guys have taste buds. Then when we look at the side of the tongue, we see ridge. You see the side of the tongue, zoom in on it, and you see ridge. What kind of papillae ridge there? Foliate. Then you see these are the what?
Circumvallate.
What is this word, circumvallate?
Circum, like a circle. Circumference.
Yeah, like those old passwords, they have a multiple passwords, so that one is called power. Called a what? Very good. And the glands open into there. What do we know about the posterior third of the tongue? Do we find these papillae in the posterior third of the tongue? Not at all. What are these called? What are we looking at here? What are all of those bumps that we're looking at?
Lymphoid follicles.
Lymphoid follicles. Lymphoid follicles. So all along here will be what? All along there will be the lingual tonsil. Okay? And that lingual tonsil is going to be confluent with this boy. See this boy right over here? These guys here?
Alright.
Who are these guys? Palatine tonsils. So this is going to be confluent with the palatine tonsil, which is then going to be confluent with the adenoids, and that was going to form what is referred to as volatile ring. Excellent. Who is this fold right in front of the palatine tonsil? Then we're down here, down there. Where are we right here? What's that area called? Melissa, what is this area called? Right, molecularly. Okay. 300 marks.
Ooh.
The glossal
What did you
epiglottic,
say?
lateral glossal
Lymphoid
epiglottic,
tissue and
and medial
lymphoid.
glossal epiglottic fold, right? Robert, who is supplying those nerve supply down here?
Dorsolingual.
Glossopharyngeal.
Oh, that is
Where's the nerve
dorsal.
supply down here? No, like very deep.
Lingual.
Dorsolingual.
0.002.
Is it actually hypoglossal and tonsils lingual?
Here,
That was
and
pharynx.
confluent right here.
The pharynx
It is
is
very form fossa. Yes? Who is this fold here called? The aryepiglottic fold, okay? Take away these papers here coming out. Just move them for me. I want to just Three. Where does that involve? So here we're looking at the real thing. Okay? Relax. What do you think this might be? What do you think that might be? Zoom in and in for me, please. Who do you think this might be? More. Zoom in harder than that. Focus.
Trying.
Ah, very good. Who is this? Robert, who is this? No. Sublingual. That's a sublingual. Relax. Turn it over.
This is hysterical.
Who do you think this boy is right here?
I can't.
Here.
Submandibular.
That's the submandibular gland. Is this a deep or a superficial? Deep or superficial?
Superficial.
Oh, but deep or superficial?
Superficial.
Deep. Right? Look here, my friend. This muscle is what? The hyoglossus. Right? So if you go and you lift the tongue to the side, and the surgeon incises the mucosa here, you're looking down on the submandibular gland. And if I were to open up here, which nerves would you like to see? Right. So, lingual, double crossing, submandibular down. At a lower level, hypoglossal nerve, with the vena comitans nerve by hypoglossy. Okay? Good. So there you can see, which is very interesting in these tongues. The Jamaicans I noticed, I don't see it in any other place, but I've noticed it quite a few people from Jamaica. Look here, Robert, look right here. Look hard. You see all of these kind of ridges? This is what I'm noticing. Right? So in textbooks you never see that, you know. Right? Sometimes in particular for people of Jamaican descent, I don't know. Alright, you can see the tongue here. Alright. And then on the sides, you can see where the foliate would be. You see yes or no?
Yes.
You see?
Yes.
Yes or no?
Yes.
Correct. Alright. There is the one. Foramen. Who are these boys? The circumflex. And here we can see the one here. The lingual tonsil. There. With the body. Medial glossal epiglottis. Okay? Lateral glossal epiglottis. Internal branch of the superior laryngeal nerve. And if we open up right here, you can get it right there, and I can actually see the internal branch of the superior laryngeal nerve. See right down in there. See right there. Another one is better to see. I'm holding on to it. So this is where you get it. So many times the ENT person, when he's examining your vocal cord, he's putting it in the mirror of the back. He starts to gap. You know, it's terrible, he's pushing it into the mirror of the back. You know. So you take a little anesthetic and the spray right around. Right? But you have to be careful with that spray. You know. He's just trying to put a little spray back there that he can pass his little mirror to see back. Okay, but you have to be careful. Alright. MG is tired. So end of story for today. What's the time?
3:50.
Okay, 1 hour and 45 minutes.
What?
Relax yourself. No. The patient, this patient, this is a female here. This is a female. She's developed meningioma. Okay? Meningioma. Right. So this is the anterior condylar canal. Yes? You see it? Yes or no? Yes. Who passes through there? Hypoglossal. Is that good? Let me see a bit better on this. Okay, not that. And then you push it in. Yeah. Push it in. Right there. Right there. And then right there. Yeah. Almost there. Okay, so let's look and see if we can see where she pushes in. You can see the condyle, the occipital bone, yes? And that's the anterior condylar canal. Okay? So patient develops a meningioma around the area of the anterior condylar canal. Okay? From internally, inside. Okay? See from how we look at it from inside? See from inside. There. So I see 3 openings. I see internal acoustic meanders, yes or no? Yes. I see jugular foramen, and I see anterior condylar canal. So meningioma develops along there. Okay? So obviously it's going to affect the what? The hypoglossal nerve. Okay? No. There's a man by the name of Robert. What is going to happen when a tumor develops along that hypoglossal nerve?
You would lose innervation to all communities except for paraglossus.
Just take this away. Take this away. So, Robert, what is going to happen? There are many things we can do with tongue. Right? So there is the tongue. You're looking tongue out. Okay? And there is the skull right here. Okay? I'm going to put it on this side. So this is the exam question, just like that. That's already set up the exam. A station. Okay? So this is a nerve exiting there and being affected by meningioma. Okay? Right?
You can move into the.
So hold on. So therefore, push and step the hypoglossal nerves are being affected. Okay? the tongue is a medium roughing. Tongue has inside a medium roughing. So remember, if that hypoglossal nerve is going to be affected, what is going to happen? Long term. So this patient is becoming
Hypoglossal
long term.
paralysis of
This
the
part of the
tongue.
tongue is becoming more shriveled. Shriveled. It may not reach to that level, but you're doing a neurological exam. You're doing an examination. Okay? How are you going to test this? What are you going to ask the patient to do? Stick out your tongue. Stick out your tongue right there. Because it's a tiny blade. Yeah, like your tongue isn't in there. There's no tongue in there. Very good. Right, so you ask the patient, stick out their tongue. Go look at her right side. So what will happen to the patient now if the hypoglossal nerve is affected? It will deviate to the side of the lesion. So when she stick out your tongue to the right. So, no, to the right. Exactly. Look at her tongue. It doesn't like it. So the tongue comes out like that. Right. The tongue is going to deviate to the what? To the affected side. Why? Because the braided tongue is when both hypoglossal nerves are functioning, the muscles on this side, right, and looking down here on the right side, that's the left side, for looking down at the tongue. Reasonable? So this is going to deviate the tongue this way. And the muscles on that side deviate that way. Right? So that your tongue comes out in the midline. So if you knock off this boy, this forces unopposed, so the tongue will just deflect. Right? Last thing on the flyway. Remember that the anterior 2/3 general sensation, the tongue has how many types of innervation?
2.
I don't know. How many? How many types of nerve supply?
I would say 3.
One, general sensory. 2, special sensory. 3, secretomotor or secretomotor or parasympathetic. 4, sympathetic. 5, motor. So watch here, we have motor, hypoglossal, anterior general sensory, both lingual nerve and for the posterior third. Right? So motor, general sensory, special sensory, chorotympanic, reasonable, secretomotor, chorotympanic and lingual, and then glossopharyngeal, and then sympathetic. Okay? What will the sympathetic do? Oh, not bad at all. More sympathetic, but also visible. So when everything is hunky-dory,
What's for
you
sympathetic?
won't feel wet. When you're under stress,
No, like what's the nerve?
tacky, and viscid. Okay, visible. So that's 300
He
pounds.
said,
Lymphatic drainage, tip,
hold on.
central area. Central area, pin is in there. Central area, not at all. Central
Upper
area.
deep and
Tip. All right, Robert. Very good, very good. Tip. Submit.
I know.
Central.
I'm gonna call you later.
Lateral.
I need to call you later.
So if a tumor develops around here, both the mandibles are affected. Side of the tongue, ipsilateral submandible, posterior third. I would say more. What would you say for posterior third? Patrick? Superior root cervical for the posterior third of the tongue. Yeah, posterior. So superior root cervical. You may fly away.
okay. He said he didn't
Yeah, they were putting for lab one. Oh, yeah.
Joel. Let's stop it.
Oh, yeah.